Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we considered the first odd or eccentric personality disorder, namely paranoid personality disorder or PPD, in detail. In this episode, we analyze the second type of odd or eccentric personality disorder, namely schizoid personality disorder, in detail. Schizoid personality disorder is included in the odd or eccentric cluster, which involves unusual, peculiar, and strange thoughts, feelings, and behaviors. Schizoid personality disorder is a mental health condition that is marked by consistent pattern of detachment from and general disinterest in interpersonal relationships, lack of emotion, lack of motivation, and almost no desire to form relationships with others. People with schizoid personality disorder, though may function fairly well in the society, appear strange and peculiar as they behave differently from most other people. They avoid social interactions, detached, distant, and aloof when it comes to social relationships, and lack personality. They prefer solitary activities to those involve others. For instance, they would enjoy doing solitary jobs such as night security watchman, which others may find it difficult. Thus, you may experience them as eccentric loners. As typical loners, they are prone to excessive daydreaming and forming undue attachments to animals. They express limited range of emotions when interacting with others, do not care about praise or criticism from others, choose to be alone, and typically do not seek close relationships. They are not able to express intense or strong emotion, regardless of the situation or circumstance. For instance, if you would share a tragedy that occurred in your life with a person having schizoid personality disorder, he or she would display very little or no strong emotion at all in responding to you. Healthy individuals may experience for short periods or a couple of times in their lives where they feel no emotion, motivation, or desire to engage with others. However, individuals with schizoid personality disorder have a long-term and persistent pattern of indifference to social relationships, detachment from society, limited range of emotions, and lack of interest in engaging with others. Schizoid personality disorder manifests itself in early adulthood through social and emotional detachment. Its prevalence is around 3.1 to 4.9% of the population. Though its prevalence rate in men and women are even, its frequency is slightly more in men than women. Though schizoid personality disorder and schizophrenia share an underlying genetic architecture, as social withdrawal and social awkwardness are characteristic of both the disorders, there are important differences between them. Schizophrenia causes significant disconnection from reality. It also involves experiencing a combination of hallucinations, delusions, and extremely disorganized thinking and behavior that can dramatically impair daily functioning. However, schizoid personality disorder neither causes disconnection with reality nor involves experiencing hallucinations, delusions, and disorganized thinking. and so it usually does not significantly affect a person's day-to-day functioning. Persons who suffer from schizoid personality disorder may manifest the following symptoms: being dull and humorless, being socially distant, detached, cold, and aloof, neither desiring nor enjoying closer relationships, but avoiding them even with those within the family, being indifferent to criticism and praise, rarely experiencing and expressing strong emotions, having difficulty in relating to people in social situations, taking no pleasure in activities involving others, including sex, choosing solitary hobbies, activities, jobs, and careers, behaving in ways that are socially odd or eccentric, being unable to pick up normal social cues or signals, daydreaming and creating vivid fantasies, believing that relationships put an unacceptable limit on personal freedom, having trouble with self expression, exhibiting little observable change in moods, lacking motivation or life goals, and being unable to enjoy activities. Most experts agree that no single factor is responsible for the emergence of schizoid personality disorder, but it develops as a result of a complex matrix involving nature, nurture, and environment. There is a high risk for and genetic susceptibility to develop schizoid personality disorder in families of those with illnesses on the schizophrenia spectrum. Some studies place the rate of hereditability at approximately 30%. Thus, it is caused by a combination of genetics, temperamental factors, and social environment during early development. Researchers indicate that psychological temperament shaped by environmental factors such as upbringing and learned coping skills, along with biological or genetic predispositions, play a critical role in the development of schizoid personality disorder. Schizoid personality disorder neither can be prevented nor can be cured, as this is a chronic and lifelong condition. Since most sufferers do not seek or want help but prefer social isolation, there is no chance of this disorder improving as they age. Hence, the prognosis or the long-term perspective regarding schizoid personality disorder is not very positive. However, most people with this disorder can live a fairly normal life if they seek help, get their condition diagnosed, and commit themselves to a lifelong treatment plan. Diagnosis of schizoid personality disorder is often difficult, as those who suffer from it neither feel there is anything wrong with them, nor are they thinking and behavior are unusual or problematic. Hence, they neither seek nor want diagnosis and treatment. Often it is family members or friends bring them for diagnosis and treatment. Diagnosis of schizoid personality disorder includes a full physical and psychological evaluation. Medical doctor will conduct a full physical examination to rule out any underlying medical condition. Then the affected person would be referred to a mental health professional who will complete a full psychiatric assessment, determine if the person is affected by schizoid personality disorder, and create a treatment plan if the person is pursuing treatment. Treatment includes medication, therapy, or both. Though there is no specific medicines to treat schizoid personality disorder, the mental health professional may prescribe short-term medications to treat depression, anxiety, or other psychological conditions the affected person may experience. For the success of any therapy, the therapist must establish basic one-to-one working relationship with the client. Any therapy that helps persons with schizoid personality disorder to readjust their distorted thought patterns, to open up and reveal more about their inner experiences, to facilitate them to develop authentic friendships and interpersonal bonds, and to establish better working relationship with a therapist could be used in the treatment process. Besides, therapy should focus on simple treatment of current pressing concerns in the affected person's life rather than curing the individual. In the next episode, we will consider the third odd or eccentric disorder, schizotypal personality disorder. Thank you for watching this video. Stay blessed until we see you again with another video.